help answer any questions that you have. And you can put them into chat. And also, towards the end, there's about 30 minutes or so for questions and answers. So this talk normally goes on for about 90 minutes. It's going to be practical and it's going to be theoretical as well. There's a couple of aspects about breathing. If I was to give my own take on it, breathing should be accessible. Breathing should be implemented into what somebody already is doing. And it's very important that people understand the science as well behind it. But before we kick off, I'd like to get an idea of where you are coming in from. So I might start off with Bill Dinner. I've seen you before, Bill, I think. Where are you coming in from? What do you do?
Where do I come in? I'm actually living in Florida at the moment, in Sarasota. I've done a lot of breath work, a lot with Robert Moses.
Great stuff.
Yeah.
Well done. And John, where are you coming in from? What do you do?
I'm coming in from Soldotna, Alaska. I work with. I've done a lot. I've been on a lot of your stuff, and I've done some of the training. I am predominantly working with junior elite level ice hockey and wrestlers, adolescents, mostly kids trying to get to college.
Great stuff. Well done. And Shiram, I'm not sure if you can hear me or not. There's no camera there. Where are you coming in from? What do you do? If I don't hear from Shiram, I'm going to go on to Diego. Hi, Diego.
Hey, thank you. Nice to meet you.
Likewise.
First time here.
Good. Where are you coming in from?
I'm Chilean, living in Canada, Ontario.
Oh, wow. Great.
Yeah.
Thank you.
I'm a psychologist and coach, and I work a lot with athletes, especially Brazilian Jiu-Jitsu.
Great. Well, this is application for BJJ, so it has. Huge.
Thank you.
Joe, I'll come back to you because we'll be chatting with you in a while, so thanks very much. Angela, if you can hear us, where are you coming in from? What do you do?
Hi there. Sorry, I'm battling my very senior dog here.
That's all right.
I'm in Nova Scotia, Canada, and I've been on several of the sessions, and I recently finished my certified functional breathing instructor. So
great. Yeah. Well done. Yeah. Well done. Super. Thank you, Angela. I hope you get your dog under control.
We do.
Christian, where are you coming in from? What do you do?
I'm coming from Beach Box, Huntington Beach.
Huntington Beach in California, isn't it?
Yeah.
Yeah. Great. And I only see iPhone 265, so I'm not sure who the gentleman is. So I might. You're still on mute, actually.
Let me see. Can you hear me?
Perfect.
Or is it me or someone else?
No, it's somebody else, Christian.
Oh, okay. Pardon me.
You're all right. Don't worry, I'll just move on. It's just to get a flavor of who is in the room. Tony Poland, where are you coming in from? What do you do?
Los Angeles, California. I'm a sports massage therapist.
Great. Welcome. And Eric Dubiner.
Hi, I'm Eric, coming in from just outside Boston, Mass, and first time attendee.
Great. Welcome.
Thank you.
And Thomas, where are you coming in from? What do you do? Sorry there. It's on mute.
There we go. Yeah, just try to unmute. Hi, I'm coming from Copenhagen, Denmark. And I'm an actor, but I'm also a Wim Hof instructor. And I hopefully will submit my exam for the Oxygen Advantage very soon.
Good.
I have my case studies done, but I need to do the exam.
Good. It all happens in its own time.
Exactly.
No pressure.
Cheers.
Nicole, where are you coming in from? What do you do?
Hi, I'm from Calgary, Canada, and I've been a personal trainer, nutritionist for prenatal, postpartum, and now perimenopausal women for about 11 years now.
Great. Welcome, Nicole. And finally, Christian, where are you coming in from? What do you do? It's you this time, Christian.
Oh, me. Okay. So I'm coming again, Huntington Beach at Equinox in Huntington Beach. I'm a coach. I work particularly as a movement specialist, and a background as a professional dancer. And yeah.
Great. Equinox Gym. So thanks very much to everybody for coming along. And I hope you'll have some takeaways at the end of this. I really believe that breathing is going to be a very important pillar in sports and fitness, and it's going to happen pretty soon. I think breathing has been overlooked for many, many years, and I can understand why, in terms of it wasn't always communicated well. It wasn't supported by science. It was seen too left of field. People didn't understand it. And that's what with the Oxygen Advantage, when I was writing the book, it's 10 years old now, so it's going back quite a bit. I do have to revise it, which I hope to do this year or next year, depending on time. But yeah, there's a huge place for breathing in sport. I'm going to go through a PowerPoint presentation, and I will be coming in and out of it. But even as we have a person here who is a personal trainer, we have to think about breathing in the same vein and the characteristics of what makes an effective personal trainer. Somebody with technical expertise, somebody who's able to communicate effectively, somebody who's able to solve problems, monitor progress, and adapt a program to the client based on age, state of health, and also to motivate that client. And breathing shouldn't be any different. You know, we should be really making breathing so accessible that it's just integrated into any fitness routine, because there's so much. Even if you think of just oxygenation, people often think about the airflow that comes in and out of the nose or mouth, but they never think about the airflow that's downstream. We can influence, of course, whether we breathe through the nose or through the mouth, but we can also influence alveolar ventilation. That's the volume of air that reaches the small air sacs in the lungs for a gas exchange to take place. We can influence oxygen transfer from the lungs into the blood, and we can influence oxygen delivery from the blood to the tissues. And that's just by understanding a little bit about breathing. And ultimately, breathing as well is quite simple. It typically involves an inspiration and an expiration, a breath in and a breath out. And that's what we're working with. So you have either upregulation, that you can put the person into such a strong stress response to cause the body and mind to make adaptations, or you can use the breath to downregulate, and everything in between. So downregulation in terms of faster heart rate recovery, optimizing heart rate variability, balancing the autonomic nervous system, improving sleep. And then, of course, you can bring the whole aspect about the mind into it, developing the capacity to hold attention, to concentrate, to reduce mind wandering, to reduce overthinking, to make better decisions. And that too is through the breath. So even to access flow states, breathing will play a role there, because if we're in a state of anxiety, and anxiety often culminates with faster and harder and upper chest breathing. And of course, if we breathe that way, we're telling the brain that we're under threat. Well, that's going to sabotage flow. We cannot access flow if our autonomic nervous system is in an increased stress response, if we have poor sleep. So there's an application. I'd like you to give this a go. This is the BOLT test. All it does is it tells you your degree of functional breathing. So your everyday breathing, how well do you breathe every day? And if you can take the test, if you don't mind. Now, I'm not going to ask you your results, so don't worry. It doesn't matter what you get. It's just something for you to practice. I would like you to take a normal breath in and out through your nose and pinch your nose and time it in seconds. How long does it take until you feel the first definite desire to breathe, or the first involuntary movement of your breathing muscles? And when you let go, you should have normal breathing. This isn't your maximum length of time that you can hold your breath for. This is the length of your comfortable breath hold time. So you could see it a little bit differently. Taking a normal breath in and out through your nose, pinching your nose, and holding your breath, and continue holding your breath for as long as you can once you have normal breathing when you resume breathing. So the key is, how long can you hold your breath for and still have normal breathing when you resume breathing. We will come back to it. It's not perfect, but in terms of functional breathing, it's multidimensional, and this is a very simple screening tool. And I'll talk about then the relevance of your BOLT score in terms of people with a lower BOLT score and the implications for fitness. My personal journey, I came into breathing about, 1998, so we're talking about 27 years ago, 26 years ago. It's half my life. So I spent half my life stuck in my head with open mouth breathing, breathing fast, breathing shallow, and launched into an increased stress response, poor sleep, as many people are, and many people today. And I was lucky enough, I came into breathing, applied it to myself, and it wasn't any old breathing technique. It wasn't just taking a full deep breath or oftentimes what you hear, but it was specifically breathing to help improve blood circulation and oxygen delivery, and to help change everyday breathing patterns so that it was lighter and slower. It actually involved breathing less air, because I never knew it at the time back then. I never knew that if you wanted to improve your blood circulation, it wasn't about breathing more air. And many people intentionally will take full deep breaths or fill their lungs with air in the belief that it better oxygenates the body, and that's not correct. It doesn't do that. You can take more air into your body, but you'll just breathe out the oxygen again. So there's a difference between the air that you bring in and the oxygen delivery to where it's needed. And ultimately, we should be thinking about not just about the air that's coming into the nose or mouth, not just about the air that comes into the body, but how much oxygen is being delivered to the tissues and organs, including the heart and brain. So the techniques that you can trust, I changed careers and I've been training and teaching breathing since 2003. I wouldn't consider myself a researcher. I research in terms of my own books and things like that, and the PowerPoints and the breathing courses. But ultimately, it was with working with people. And I worked with thousands of people over 23 years. I even had my clients last night. So using techniques that I have seen the results, and of course I've tailored and tweaked techniques along the way, just in order, taking into consideration the person in front of me. We have a vibrant community. We're one of the largest breathing instructor training organizations in the world in terms of numbers. So we have about 13,000 people who have completed our courses, and we have millions of users globally. So, for example, some of the books have really, been bestsellers, including the Oxygen Advantage, and that's in 16 languages. So we are a market leader in terms of e-learning, our portal, and ongoing support. We have monthly meetings and things like that in terms of people who do the training. So a few different levels. So level 1 is all about the basics. Whenever you think about breathing, your everyday breathing is your functional breathing. That's how you're breathing right now. And taking into consideration, how fast are you breathing? What's driving that? How high do you breathe? Do you feel comfortable with your breathing? Or are you running out of air with your breathing? Do you take full breaths? Do you take light breaths? And how you breathe during rest determines how you breathe during physical exercise. So many people have poor breathing, dysfunctional breathing. 50% of people with lower back pain have dysfunctional breathing. 75% of people with anxiety have dysfunctional breathing. But a lot of people with perfectionist tendencies also have dysfunctional breathing. And you have to bear in mind that athletes are going to fall into that group because they set high demands on themselves. One paper, which was published in the Journal of Strength and Conditioning Research, identified that 90% of athletes had dysfunctional breathing from a biomechanical point of view, meaning that they were breathing high instead of low. And if you're breathing high, it means that you've got reduced recruitment of the diaphragm, and it's not providing the same stabilization of the spine. And as a result, then it's going to affect movement. So dysfunctional breathing means dysfunctional movement, and dysfunctional movement means increased risk of injury. So anyway, level 1 is functional breathing instructor. That's the first level. And then we have breathing for yoga. And this is based on original breathing in yoga. It was not about taking full deep breaths. It was about conservation of the breath. And original yogi masters could stop breathing for 3 and 4 and more minutes. They could suspend or reduce their breathing to 1 breath per minute, continue with that for 1 hour and more. They had a practice of sealing one nostril completely and partially sealing the other nostril, again, restricted breathing. And they had a high tolerance of the gas carbon dioxide, because ultimately it's the gas carbon dioxide and your sensitivity to it that drives your breathing. It was only in 1880 that yoga breathing changed, and it happened in Europe. The idea to take these full deep breaths. So that's often what you hear in yoga today. So I did write a book on that, Breathing for Yoga, looking at the original breathing in yoga and what the original yogi masters knew. They knew about breathing, because I always wondered, they couldn't have got it wrong, and they didn't get it wrong, but the information got lost over the centuries. Level 1 and level 2 then is advanced. So that's when you combine everything. And that comes with 7 by 2 hours of Zoom sessions then in a classroom environment with myself. So those are just kind of the different aspects to it. Now, I will go through a breathing exercise. I'm going to go through a few actually. Improving your blood circulation. And I'll show you how, in terms of, that's going to be related to your BOLT score. And if you have a lower BOLT score, it does mean that your breathing is a little bit faster and harder. And faster and harder breathing can cause your blood vessels to constrict and narrow. And that would have relevance during physical exercise. I did a podcast recently with Dr. George Dallam, who had written a paper on cardiovascular health in endurance athletes. And with that, he spoke about a lot of endurance athletes have fibrosis of the heart. They have scarring of the heart because they're spending a lot of hours, of course, in training and in running. And during that time, they're more likely mouth breathing. But mouth breathing, depending on their underlying breathing pattern, could be causing too much carbon dioxide to be removed from the lungs and blood, which in turn is causing reduced blood flow. So an endurance athlete unknowingly may be causing their blood vessels to constrict. And the problem with that is that even though they are working their heart, but their heart is receiving less blood flow and less oxygenation. And George Dallam's podcast, when I was interviewing him, he spoke about the importance of nasal breathing during physical exercise to improve blood flow throughout the body and increase oxygen delivery. And it's not just the heart, it's also the brain and the working muscles. So we can open up the airways, nose and lungs. We can bring this into pre-match preparation. Also, by improving your everyday breathing, you delay the onset and endurance of breathlessness, and you can significantly reduce exercise-induced bronchoconstriction. So that's your functional breathing. And of course, there's a relationship between your functional breathing and movement. So for example, athletes with dysfunctional movement have a greater risk of injury. And in the functional movement screen, which is often used by physical therapists, 87.5% of people in one study by Bradley, 87.5% of people who passed the FMS had functional breathing from a biomechanical point of view. Yoga breathing, instructor training is all about taking breathing off the mat. You know, how do you bring breathing to your students that if you have a student with anxiety or panic disorder or asthma, how do you tailor breathing according to that student? Because it's a different approach. And I sometimes learned the hard way working with people with panic disorder. And if I went in a little bit too hard with any breathing exercise, I could tip them over. And of course, you know, you learn from your mistakes and you'll also tweak it. And with people with panic disorder, I always have to bear in mind, what relationship do they have with their breathing? You know, how far do I want to, and what do I want to achieve with them? They can have a strong chemosensitivity to carbon dioxide. They can have a terrible fear towards suffocation. Sometimes they'll even feel, they'll feel quite fearful just even paying attention to their breath. So this is where you change breathing exercise then to suit that individual. The advanced stuff is body, mind, sport. So this is advanced instructor training. I have to say the biggest thing that I think that in terms of breathing is to be able to get out of your head, to be able to develop your capacity to concentrate, to hold your attention on one thing. And of course, to achieve that, you need to have balance of the autonomic nervous system, but you also need to have good quality sleep. But how you breathe during the day is going to influence your breathing during sleep. And say, for example, if you have an athlete or any individual with poor sleep, well, they're not going to have the same degree of concentration. They're more likely to ruminate. They're more likely to overthink. They're more likely to get injured. And if you don't have concentration on what you're doing, well, your quality is going to suffer. So accessing the zone, people talk about, well, how do you access flow states? and you often hear it bandied around, but can you reproduce it? Can you switch that on when you need it? Can you get out of your head? Can you put the critical mind aside? And what are the tools to access this? And of course, concentration is one of them. But how do you develop your capacity to concentrate? And the thing about breathing is it's paying attention to your breathing as you train. And it's paying attention and bringing your attention onto what you're doing during the training. So physical training should never be just about training the body. Physical training should be about training your breathing, because ultimately your degree of breathlessness during physical exercise is influenced by how well you breathe. But physical exercise should be about training the brain. So can you stack it? And it's not that you have to do any more than what you're already doing. A lot of people do physical exercise, they're just going through the motions. And yet they expect to have concentration and focus when they need it. It's not going to happen. Now, say, for example, our people here from the Brazilian Jiu-Jitsu, we do long breath holds. We do put people into quite a strong state of breathlessness. We do disturb the blood gases. We lower blood oxygen saturation. We increase carbon dioxide. And that's to cause adaptations. So that would have a stronger effect than, say, for example, high-intensity interval training. And in team sports, it has been proven to increase repeated sprintability. So in one study by Wurons that was published a couple of years ago, repeated sprintability in highly trained rugby union players, it increased by 64% from 9 reps before exhaustion to 14.8 reps before exhaustion. And that was using breath holding to cause adaptation. So you can be clever with breathing exercises. You know, it's not just about lying on a mat and taking full breaths and hyperventilating and things like that. And all of that, of course, is good, but you can really tweak it. And yeah, that's what I will be bringing you into some of the practices. So I will give you the down regulation exercise and I will give you the stressor. But before that, I'd like to bring in Joe Samadi, who is an Oxygen Advantage instructor. So the floor is yours, Joe, if you're still here, which I hope you are.
Here, yes. Thank you so much. Patrick,
Sure.
is there anything you want me to speak on?
Yeah, do you know, I suppose people, when they think about breathing, have all a different perception of it. And my quest would be is that breathing should be accessible. It's a tool that can be used for everybody. And maybe in your own practical experience, a little bit about you and how do you integrate breathing into what you do? Or if you're working with your clients, how do you integrate breathing? And what do you notice about your clients' breathing?
Well, I started off as a yoga teacher back in 2007. And I was instructed to do all the things that, we're hearing now that weren't productive. So we never really learned anything about being able to have softer breath, slower breath, more light breath. The classes I was teaching in 2007 and on, it was very loud breathing. We almost were breathing as a unison. And it made the breathing kind of like an aerobic activity in some way. So in many ways, I needed to relearn what breathing was all about. And as I got closer into meditation through the years, I learned better that an effortless breath is a healthy breath, and a healthy breath is going to be a long-lasting for your whole well-being. But you specifically brought me into the athletics of it all. I didn't apply breathing into my own sports, my own interests, running and golf and those types of things. So when I entered into the Oxygen Advantage community, it was an awakening around being even more conscious around breathing, even being more responsible to take what is available to us, which is already there, and be more conscious about it and be more intentional about it. I was a gym goer with the mouth wide open, I was a runner with the mouth wide open. And so as basic as this sounds right now, just saying it was life changing. It did, because I'm in my 50s now. So I need all the resources I can possibly have. And meeting the Oxygen Advantage community has made a big difference in terms of the way I approach my work. I suddenly wanted more of my focus to be on healthy, functional breathing. And my specific take on breathing is about mental health. So I'm probably one of the very few instructors who who are speaking directly into how your breathing is affecting your mental states from a mental health perspective, and that athletes shouldn't need to suffer so much if they were taking more care of their everyday functional breathing. And I think the approach in Oxygen Advantage is helpful because it's bringing accessibility to breathing in the conversation of training, which is super important, but then we also need to take it out of training and into everyday life. And I think it's important that we monitor our breathing, we're more responsible for our breathing, we have a deeper relationship to our breathing. And I think that's where we're leaping into a new frontier with how we reach. And what I love about the Oxygen Advantage, quite frankly, is the amount of research, and it's constant in terms of how much information that you're putting out there and how much you're providing for us and how exciting that is. You're constantly writing new articles and new books, and the portal seems to be overwhelmed with content. It's a very fresh frontier. And so I feel like I'm giving my clients so much because there's constantly new information. But the very foundation, the very basics of this conversation, they're so accessible, so relatable, and so important. And it's still, I just went to a mental health conference in Denver, Colorado, which is where I'm living in Colorado. And I was around 200 mental health practitioners, and nobody knows about this breathing to mental health relationship. Nobody is talking about it. So there's a huge opportunity to impact athletes and their well-being through breathing.
Great, Joe, you've said it all. Thanks very much. I'm just going to share a couple of papers. So in case you were wondering, in terms of two papers I cited, so I might as well show them to you. I think it's interesting. The first is looking at dysfunctional breathing in athletes. And this was the paper that was published in the Journal of Strength and Conditioning Research. It was they looked at 1,900 athletes in Japan from, I think, in around 2017 to 2020. And their conclusion with this was that dysfunctional breathing patterns, 90% of athletes. And the range, so the highest percentage of dysfunctional breathers were in middle school at 93%, followed by elementary school at 91%, high school at 90%, professional, semi-professional athletes at 87.5%, and collegiate athletes at 84%. And they talk then, of course, the whole aspect about breathing and the application. And this is functional breathing from a biomechanical point of view. So here we're talking about at rest, individual naturally and effortlessly breathes. And a healthy person, they will have optimal biomechanical breathing. So in other words, considered to be diaphragmatic. And of course, that's providing stabilization of the spine and generation of intra-abdominal pressure to provide support, etc. So if, for example, you're breathing in the upper chest, then that can be that there's growing evidence of associations between altered biomechanical breathing patterns and numerous musculoskeletal conditions. So in terms of, one would be lower back pain, neck pain, temporomandibular joint disorders, forward head posture, things like that. So it's important from a biomechanical point of view. And then I spoke about using breath hold stressors. And I will show you kind of a variation of this. And this was tested in elite rugby union players. Now, this would have application in sprinters, team sports, BJJ, boxing, etc. Repeated sprint ability in an athlete is a person's ability to do all-out effort, followed by very brief recovery before they have to do it again. This was during peak season. They were professional athletes, I think average age of about 21 years of age, and taught them breath holds during movement. So dynamic breath holding, the same that we teach at Oxygen Advantage for 23 years. And they looked at the repeated sprint ability at the start, before they started doing breath hold training, was 9 reps before exhaustion. And after 14 weeks of bringing in some sprints with breath holds, they increased their repeated sprint ability to 14.9 reps before exhaustion. In the group who did normal breathing, their repeated sprint ability was 9.8 reps before exhaustion. And after 4 weeks of sprinting with their mouths open with normal breathing, it increased slightly to 10.4 before exhaustion. So the group who were doing breath holding during their sprints, they had a 64% increase in repeated sprint ability. Now, that's not taken into consideration. So that's only two aspects of what is important to look at. You know, you have got a high performance aspect of it. And of course, then you have the functional aspect of it as well. Let's start off with breathing light. This is probably my favorite breathing exercise. This exercise is more about down regulation. It's also about improving your tolerance to carbon dioxide, because very often we feel with breathing, we should be taking the full deep breaths. But if you breathe more air than what you need, you blow off too much carbon dioxide, your blood vessels constrict, you've got reduced blood flow throughout the body, and you've got reduced oxygen delivery. So ironically, if you want to increase your blood circulation and oxygen delivery, the objective is to breathe a little bit less. Now, also as you breathe a little bit less, you're putting the mind into a slight state of stress. So you're going to feel some degree of air hunger. Air hunger is a primal fear. The whole objective here is to surrender to the feeling of air hunger. And with that, you will be training your brain not to react to discomfort. But another aspect is, even though you feel air hunger, which is psychological stress, how does your body react to it? And that's what we're going to look at. So I'd like you all to give it a go, because ultimately the experience is when you put it into practice. After that, then I will go through a couple of different exercises. So for example, the stressor exercise, but I will show you how to do it, that it's safe, and I will give you precautions. But I'd like everybody to give this one a go. You have one hand on your chest, one hand just above your navel, and to bring your attention out of your mind and onto your breath. So there's only 4 places at which you feel the airflow coming in and out of the body, but your nose is probably the easiest. So you may feel the slightly colder air coming into your nose and the slightly warmer air as it leaves your nose, and to hold your attention there. So direct your attention to where you feel the airflow coming in and out of your nose. And then as you hold your attention on your breathing, I would like you to slow down the speed of the air as it comes in and out of your nose. So can you breathe into your nose, but can you breathe in so subtly, almost that you are hardly breathing? Really soften and slow down the speed of the air coming into your nose, almost that there's no turbulence of airflow coming into your nostrils. Can you breathe in so smoothly that the fine hairs within the nostrils do not move? And as you breathe out, can you bring a total feeling of relaxation to the body and allow a relaxed and a slow and a gentle breath out? Now, after this, I will talk about bringing down your heart rate in practical experience. But let's just stay with this for a moment. I would like you to take a very, very soft and slow, gentle breath into your nose, and a relaxed and a slow and a gentle breath out. I need you to hide your breathing from me. I need you to reduce your breathing by about 30%. Ideally, you feel air hunger. I need you to feel a sensation that you would like to take in a deeper breath. How do you develop that feeling? Breathe less air. So instead of taking your normal breath in, can you really slow down the speed of the airflow as it comes into your nose? Can you breathe so softly that you feel hardly any air coming into your nostrils? And at the top of the breath, bring a total feeling of relaxation to the body and allow a slow and relaxed and a gentle breath out. Now, it is normal that your mind is going to wander here, but every time it does, bring your attention back onto your breathing. And every time you bring your attention back onto your breathing, you're helping to develop your capacity to hold attention. You're strengthening your attention muscle. How many of your athletes have been trained to hold attention? And the breath is a very, very simple way to do it, but not just about paying attention to your breathing. Deliberately change your breathing pattern to increase blood flow to the brain. If you have air hunger now, you will have about between 5 and 10% increased blood flow to the brain, on the basis that every 1 millimeter of mercury increase of carbon dioxide improves blood flow to the brain by 2 to 3%. And we would expect with this exercise, and we have tested it over the years, that you would have an increase of carbon dioxide in your lungs and as a result in your blood of about 2 to 3 millimeters of mercury. So that's a 5 to 10% increase of blood flow to the brain. How do you increase blood flow to the brain? Breathe less air. So take a very, very soft and slow, gentle breath into your nose, and a really relaxed and a slow and a gentle breath out. And it's not about forcing it into place. It's not about tensing up the body. It's not about restricting your breathing. All it is can you bring a feeling of relaxation to your body and gently soften your breath to the point that you're taking less air into your body? And that also, it takes a certain degree of concentration, but this is tremendous for the brain. This is tremendous for the mind. So again, you're taking a really soft and slow, gentle breath in, and a relaxed and a slow and a gentle breath out. You're doing it correctly if you feel air hunger. The air hunger shouldn't be too much. If you have involuntary contractions of the diaphragm, the air hunger has gone too far. If you're feeling tense, the air hunger has gone too far. If your heart rate is elevated, your air hunger has gone too far. So this takes some degree of concentration. I need you to feel breathless and relaxed at the same time. Okay, take a rest, take a rest. I'm just curious, how many of you felt air hunger during that exercise? How many of you felt breathless? Yeah? Did you notice any change in the saliva in your mouth? Is your mouth drier? Is there more moisture? Or is it the same? So if you just put that into the chat. And the other thing is, did you notice any change in the temperature of your hands? Are your hands colder, warmer, the same? How is your state of mind? Are you sleepier? Are you more alert? Or are you the same? Now, many of you were new to it, so the results can be a little bit skewed, but that's okay. It's your first time doing it. And I'll typically explain where we're going with it. So one was saliva. One was degree of sleepiness. And one was hands. So if, for example, you notice that your heart rate is a bit higher and your mouth goes dry, it indicates that the air hunger just tipped you into a slight stress response. So this is the conflict with this exercise. Where we're looking to go with this is, we are looking to gently soften and slow down your breathing to the point that you tip into a relaxation, rest and digest response. This is about recovery. So in general, so it's fine anyway, like in terms of when people are starting off, but this is where it gets practice. You know you're doing it correctly when your body responds with increased watery saliva. And the thing about this is that you can do it fairly quickly. You can dampen the stress response and increase the relaxation response in about 3 to 4 minutes. And it's not just about paying attention to the breath. It goes beyond mindfulness. And it's about breathing less air. That's why I find it a useful exercise. Now, I'll give you an example. One of our instructors was working with a top-level golfer, one of the world-class golfer. He was walking down the fairway. His heart rate was up at 160 beats per minute. He's only walking, but yet he's tipped into a massive stress response. And they knew this by the wearable device that he was using. When the instructor was working with him and they went through his data, they then gave him simple techniques to keep his heart rate low. Very, very simple. How do you keep your heart rate low? The whole thing about any stress response is not to hyperventilate. And hyperventilation is when we are breathing faster and harder. And if you're breathing faster and harder, what's your body telling the brain? Your body is telling the brain that you're under stress. So anytime that you go into a degree of faster and harder breathing, well, that can put us into a fight or flight response. And if we're in a fight or flight response, we're not going to focus. We're not going to deliver a good result. We're not going to have our attention on the doing because our brain is more concerned with getting away from that situation. So you can bring down your heart rate pretty quickly. And here's how. It's all in the speed of the exhalation. There's nothing for anybody to see. So what I would like you to do now is, it's very similar to the last exercise, but you don't have to have air hunger. I would like you to locate your heart rate just at the angle of your jaw. So just at the angle of your jaw there, you'll feel the speed of your heart rate. So you have arteries there, and locate. You might also get it at the wrist crease as well. All I would like you to do is take a soft breath in through your nose and a really relaxed and a slow and a gentle breath out. There's no need to hear anything. There's no need to breathe more air. All it is can you take a soft breath in through your nose, and can you slow down the speed of your exhalation? And whenever you slow down the speed of the exhalation, you stimulate the vagus nerve. It secretes a neurotransmitter called acetylcholine, and this causes your heart rate to slow down. This is the opposite to how most people breathe when they go into a stressful situation. Because most people going into a stressful situation, if they have pre-game anxiety, they will breathe faster and harder. And we don't have focus. We cannot think straight when we're in that state. So we have a lot of control over our own physiology. We have a lot of control over our state of mind, and Joe alluded to it as well. How do you get the critical mind out of the way when you're going into an event? Because the problem with the critical mind is it's too slow, it sabotages us, and it gets in the way. And you have to bear in mind that any athlete, anybody who has trained hard for a number of years and they've mastered their skill, all of that information is stored in the brain, and all they have to do is get out of their own way. And this is where breathing comes in too. But it's not just breathing, it's the relationship between breathing and the autonomic nervous system, and also breathing and your sleep. Okay, were you able to slow down the speed of your heart rate by simply slowing down your breathing? Practice that after you've done some physical exercise. Practice that going into stressful situations. You could be going into a difficult meeting. You're starting to feel that your heart rate is a little bit faster, and you want to bring down your heart rate. You simply stand there or sit there, and you take a soft breath in through your nose, and a relaxed and a slow and a gentle breath out. Now, of course, we could add to that by breathing nose slow and low, because it helps to improve alveolar ventilation, but don't worry about that. Even just that little tool there can be quite useful. You practice that in your normal everyday life, and then when you need it, it's there for you. And there's a comfort knowing that, yes, you can put yourself into a challenging situation, and if your physiology lets you down, you know, and you have some degree of control over it. There's a great comfort in that, which in turn will alleviate the fear of going into the situation in the first place. I'm going to go back to the breathe light exercise. I would like you to have one hand on your chest and just one hand above your navel, and I would like you to pay attention to your breath. And all I want to do is keep the instruction simple. I would like you to feel air hunger, to feel breathless, to feel the need that you would like to take in air, but not too much. So we want to hit the sweet spot. Can you influence your blood circulation? Do you notice any change in the saliva in the mouth? So ideally what we want to do is activate the digest response. Recovery is also very, very important. Yes, we can stress the body and mind with breathing, but we can also recover quicker too. So you're taking a soft breath in. I'm going to change it a little bit. Instead of really slowing down the speed of the breath coming into the body, can you take in about 3/4 of your normal breath? So 3/4 of the breath in, and then a really relaxed and a slow and a gentle breath out. I need you to breathe less air into your body now than what you were breathing before you started. And if you breathe less air, carbon dioxide accumulates a little in your lungs. And as carbon dioxide accumulates a little in your lungs, it will accumulate in the blood leaving the lungs. And if you do this for 1 minute, you then will have increased blood flow to the brain. And if you think of the brain as an organ that consumes 20% of your oxygen, and if you were in a state of faster and harder everyday breathing, it's going to reduce blood flow to the brain. This is doing the opposite. So you're taking a short breath of air into your nose, not taking your normal breath in, taking in about 70% of the normal breath. And then at the top of the breath, bring a total feeling of relaxation to the body and allow a relaxed and a slow and a gentle breath out. The whole objective is slow down and soften your breathing to the point that you feel that you're not getting enough air. It's not by holding your breath. It's not by freezing your breathing. It's not by deliberately interfering with your breathing muscles. It's just by gently softening and slowing down the speed of your breath. You want to have an air hunger that you're on the verge of disrupting your breathing pattern, but not going past it. So in other words, can you feel breathless and relaxed at the same time? And as you do that, This takes a little bit of practice. This takes attention. This takes concentration. And this is also a training for the brain. Anytime your mind wanders, you bring your attention back. Can you induce relaxation? Okay. So I'd like you to practice it for a little bit. And what I'm going to do is I'm going to continue with the presentation, but for you to be practicing it as I'm going through some of the slides. Again, if your mind wanders, you bring your attention back. It's all about taking a soft breath, a slow breath, a relaxed breath. We do have a good e-learning portal. This one here just gives you a kind of a snapshot of the portal for functional breathing instructor training. This is all online. So it consists of 15 different modules, and each module has a specific topic. So you have introduction, but you also have, say, module 2 is assessing breathing pattern disorders. So if your client comes into you, how will you know how well they breathe? Because ultimately, if you're teaching breathing exercises, the objective is to improve their everyday breathing. But how would you know if their breathing is improving? You know, because breathing can be miles apart. And in order to know that their breathing is improving, you need to be able to assess it. We also go through functional breathing during rest, then functional breathing during movement, so integrating it into your normal movement, and then working with your clients, teaching format, what to teach in the first session, second session, third, fourth, client intake forms, client manuals, etc. In terms of our training, we've got a number of we've got level 1, which I explained at the very start, was functional breathing. So this is your everyday breathing. This was just the portal that I showed you a moment ago. And level 1, the price of that is $396. That's using a discount code called Fitness20, and it's valid for 7 days. Or if you're a yoga instructor, you might be interested in doing the Breathing for Yoga instructor training, which also is all online, and it's a very good portal. And of course, with each module, you have a presentation, a video of myself explaining, going through the presentation. And then with yoga, we have 2 yoga instructors then integrating breathing from a functional point of view into yoga. So say, for example, if you're working with your students, how do you improve your students' breathing as they're going through the asanas from a biochemical point of view, a biomechanical point of view, and a psychophysiological point of view? The Oxygen Advantage Advanced is including everything. So this is level 1 and level 2 all in. So this is online, but it also has 7 by 2 hour Zoom sessions with myself, which are recorded that you get lifelong access to. So that's the main difference. We also have a monthly meeting with the advanced, and there's a community as well everybody as well has access to a community in terms of Facebook, and also one of our staff look after the instructors full time. But anyway, there's a 20% discount, and the code is Fitness20. Now, there's another thing as well. If you were to sign up in the next 24 hours, you get a free starter pack, and that's valued at about $150. So that includes the sports mask, myotape. These are products I developed over the years. I didn't develop the pulse oximeters, but I developed Buteyko belt, myotape, and sports mask, and nasal dilators and things like that. That's all to facilitate breathing as well. So that's 24 hours, you'd get that pack too. So that's with the functional or advanced. Okay, now I'll just bring this slide, and then I'm going to show you bring you through some stressor exercises. I do have one in-house training in the USA this June. So it's in June 2025, from the 27th of June to the 29th of June. It takes place in Denver, Colorado, and it's at the Vivas Institute. It's just outside the airport, actually. So this is Oxygen Advantage Advanced, and it's 3 days, 27th, 28th, and the 29th. The cost of that to register it's $1,350. Okay, let's look at doing a stressor exercise. And what I'm going to do is I'm going to have you do a breath hold standing, if that's okay. So if you feel comfortable, are you able to stand and walk on the spot? And we'll bring you through some breath holds. Now, I'm going to start off very easy. and I will build it up. But a couple of caveats with this one. If you're over 60, you have to go very easy. If you're pregnant, congratulations, but please don't do them. If you have any cardiovascular issues, or if you have panic disorder, anxiety, or epilepsy, or any serious medical condition, including cancer, for example, please don't do them. You could walk simply with your mouth closed. It's a simple breathing exercise too. And doing physical exercise with your mouth closed is much better than doing physical exercise with your mouth open. Even if we were just to think of it this way, I would like you to look down at your chest. And as you look down at your chest, take the breath through your mouth. So what do you notice when you breathe through your mouth? You'll typically notice that you're more likely to be breathing upper chest. But where do you think the greatest concentration of blood flow is? It's in the lower lobes of the lungs. So with every breath, we want to have good recruitment of the diaphragm, because during inspiration, there's a negative pressure created in the thorax, but there's a positive pressure created in the abdomen. And it's the generation of the intra-abdominal pressure which is providing stabilization of the spine, and this is for movement. So if we're breathing upper chest, mouth breathing is very much more likely to cause upper chest breathing than nasal breathing. And that could reduce, well, we could develop poor breathing patterns. 96% of people do physical exercise with their mouths open. It does not make sense. If you have your mouth closed during physical exercise, you'll have increased oxygen transfer from the lungs into the blood and increased oxygen delivery from the blood to the tissues and organs. So even though it's a bit tougher initially, switching from mouth to nose breathing because of the extra load, but this is what causes the body to make adaptations. So let's start. I would like you to start walking on the spot, breathing in and out through your nose. So focusing on the airflow coming into your nose and focusing on the airflow as it leaves your nose. And can you bring your full attention onto your breathing? Can you get your attention out of your head and simply direct your attention to the airflow coming in and out of your nose? If your mind wanders, bring your attention back onto the breath. Whereabouts are you feeling the airflow coming into the body? And the objective is to improve alveolar ventilation. In other words, the volume of air that gets down to the small air sacs in the lungs. You're better off taking a slower breath, but a slightly fuller breath, as opposed to mouth fast and shallow. Mouth fast and shallow is very much energy inefficient. It's uneconomical, and the individual is more likely to gas out too soon. So now as you're walking, I'd like you to breathe in through your nose and out through your nose and pinch your nose and hold your nose and walk holding your breath for about 10 paces. So walk holding your breath for about 10 paces and then let go, but gently continue walking. So continue moving now, breathing in and out through your nose. I need you to pay attention to what's happening in your nose as you do this, what's happening in your lungs as you do this, what's happening to the degree of air hunger as you do this, what's happening in your state of alertness as you do this. So continue walking, breathing in and out through your nose, breathing in and out through your nose, bringing attention out of your mind and onto your breath. How often does your mind wander? And that'll also give you some feedback of the tendency that the human mind wanders a lot. But of course, if the human mind is wandering a lot, do we then have the capacity to hold attention when we really need it? So now for 15 paces, take a normal breath in through your nose and out through your nose, and pinch your nose and hold your nose and walk holding your breath for 15 paces. So walk holding your breath for 15 paces, and then to let go, to breathe in through your nose and to breathe normal then for about a half a minute or so. So you're letting go, you're breathing in and out through your nose and breathing normally then for about a half a minute or so. So again, bring your attention onto the breath, taking attention out of the mind and onto your breathing. You may be feeling the slightly colder air coming into the nose. You might be feeling the slightly warmer air as it leaves your nose. Use this as a training for the brain. And also check in the tendency that we spend about 50 to 60% of our time doing one thing, but thinking about something else. In other words, not having our attention on the doing. Now, what I would like you to do is to breathe in, breathe out, and hold your breath for 20 paces. and go into a light jog as you hold your breath. So a breath in, a breath out, and pinch your nose and hold, and jog holding your breath for about 20 paces. And then to let go, to breathe in through your nose and then back down to a walk, but you should be able to recover within 2 breaths. So semi-active recovery, continue walking, breathing in and out through your nose. So now you'll notice that this is a slight stressor. It's a slight stressor from a couple of points of views. One is, as we continue to increase the breath holds, your blood oxygen saturation will drop. Carbon dioxide is going to increase, so it is a physiological stressor. Number 2, it's a psychological stressor. The air hunger that you experience is going to be stronger than what you would ordinarily experience during high-intensity interval training. And also, in terms of stimulating anaerobic glycolysis, it is stronger. If you were to put a pulse oximeter on you now, when you start ramping this up, you will see that you lower your blood oxygen saturation to about 85%. It's not going to happen yet, Alexandra. We're still going easy, but it will be when we ramp it up. So now what I would like you to do is 25 paces. So whenever you're ready, take a normal breath in and out through your nose and pinch your nose and hold your nose and start jogging, holding the breath. And jogging, holding the breath. And I need you to relax into the breath hold. You will feel involuntary contractions of the diaphragm. Keep going, keep pushing, keep going, keep pushing, keep going, keep pushing. Keep relaxing into it. Then to let go, to breathe in through your nose and continue normal breathing then for about a half a minute to a minute. And anytime you're feeling overly breathless, always think about slow and low. So fuller breaths but less of them helps with gas exchange and helps with heart rate recovery. So take your attention again. If your mind has wandered, bring your attention back onto the breath. And you will also notice during this exercise that when you stop breathing, when you hold your breath, it brings a quietness to the mind. Pay attention to your nose at this point. Does anybody notice if their nose is opening or getting easier to breathe through? Has anybody noticed that yet? No? Yes? So again, we can help open up the airways. This is why we integrate a specific warm-up protocol to balance the autonomic nervous system, to open up the nose, to open up the lungs, to increase alveolar ventilation, to increase oxygen delivery. A warm-up is all about preparation for more intense physical exercise. It goes way beyond just warming up the body, way beyond. What about the nervous system? Upregulate and downregulate. Get the person into the right frame of mind. What about their airways? What about somebody with a stuffy nose or exercise-induced bronchoconstriction? You can help to alleviate that prior to going out into the competition. And again, 30 paces. Whenever you're ready, take a normal breath in and out through your nose and pinch your nose and hold your nose and start jogging, holding the breath. And relax into the breath hold and keep going, keep pushing, keep going, keep pushing, keep going, keep pushing. So you will feel involuntary contractions of the diaphragm. So when the air hunger is a little bit tough for you, let go, but breathe in through your nose and then come back to normal breathing. This isn't about excruciating, pushing you over the limit. So don't overdo it. You should be able to recover within 2 breaths, because there's nothing to be gained by pushing it too far. If you feel too much of an air hunger, it might just put you off. But at the same time, I need you to have a degree of air hunger that you feel it's a bit of a stress, but you feel okay with it. Can you relax into the feeling of discomfort? Can you relax into this sensation of breathlessness? Bearing in mind that air hunger is probably the most primal fear of the human body. That lack of air, it's a primal fear. So we're putting you into quite a significant psychological stress. Breathing in and out through your nose. Again, if your attention has wandered off, I need you to bring your attention back onto what you're doing and check in just how often your mind is wandering. So you're walking now, you're breathing in and out through your nose. I need you to have your attention on the doing. This isn't a time for planning or organizing or thinking about something other than what you're doing, yeah? So we'll do one more. Whenever you're ready, take a normal breath in and out through your nose and pinch your nose and hold your nose and jog, holding the breath. And I want you to do what you can do. So if you can go for 40 paces, do 40 paces. If you don't reach 40, well, do what you can do. So the whole objective is at the end that you're able to recover within about 2 breaths or so. So continue going, you're relaxing into the body, you're holding the breath, and then when the air hunger is quite strong, let go, breathe in through your nose, and then yes, to slow walk. So walking now, breathing in and out through your nose. So now what I would like you to do is to start slowing down the speed of your exhalation. So you could be taking a soft breath in through your nose and a slow, relaxed, gentle breath out. So if you want to lower the speed of your heart rate, always think about taking a fuller breath, taking less of them, not over breathing, but especially having a slow exhalation. Okay, so I'll bring you back to the screen. I'm just curious, how was that exercise for you? Was it your first time doing it? If any of you were monitoring your pulse oximeter, what did it go down to? Did it drop your blood oxygen saturation? So if you can put it into the chat. Okay, so typically our goal is to lower blood oxygen saturation down to 85%. And by lowering your blood oxygen saturation, the hydrogen ion coming from the working muscle doesn't get oxidized. And the theory behind it is that it associates with pyruvic acid to form lactic acid. And then lactic acid then dissociates into hydrogen ion and lactate. So it's by lowering the blood pH that the belief is, or the theory behind it, is that it causes the muscles then to adapt to increase the buffering capacity. So there are buffers in the muscles, such as bicarbonate, proteins, and phosphates. And you can increase the buffering capacity inside in the muscle compartment. So then when the athlete is really pushing themselves, it can delay lactic acid and fatigue. So we use this. This would be very similar to stimulating anaerobic glycolysis, but it's stronger. And you can measure that. You can put a pulse oximeter on a person while they're sprinting, all out effort with their mouth open. Their blood oxygen saturation will drop down to about 93%. They're barely hypoxic. If you do a breath hold during a jog, or even better during a sprint, your blood oxygen saturation drops down to 85%, down to the low 80s. It's severe hypoxia. So that's where we're looking to get to. So that's one of the stressful exercises. So coming back to our presentation, breathing goes beyond just taking a deep breath. Now I've just a few slides to go through, and then what I'll do is I'll open it up for questions. So any questions that you have, I'll help answer. So we've got 3 different dimensions to them, and we did go through that. Now, the last exercise is one exercise that we would use to lower blood oxygen saturation and to increase carbon dioxide. So this is almost that you're pushing the body into an oxygen debt and increase carbon dioxide, then to cause the body to make adaptations. And this is a pretty effective tool, and it should be applied in sports. It makes sense, and it can be done safely as well. I've been teaching this for 23 years. You know, last night we had an 11-year-old kid in, and I had him do hypoxic hypercapnic training. Coming back to your BOLT score at the very, very start, and what did it mean? Well, if you have a low BOLT score, your breathing has got room for improvement. And the objective is that your BOLT score is 25 seconds plus. Any athlete coming into me, I need to get their BOLT score ideally to about 40 seconds. So the goal is a minimum of 25 seconds. And if you have an athlete with a BOLT score of 11 seconds, that individual is likely to gas out. They're likely to be overly breathless. And a strength and conditioning coach might think that they've got poor condition, but that may not be so. They can have poor breathing. And the factors that will cause their breathing to be poor, so that they are breathing faster and harder and upper chest, well, it could be exercise-induced bronchoconstriction. It could be stress, could be trauma, could be perfectionist tendencies, could be genetics. Now, an athlete like that can still perform, but they're really pushing it. That's the only problem. You know, there's an easier way to do it to become more efficient with your breathing. So if, for example, in terms of tailoring this or comparing it to physical movement, the lower your breath hold time, the easier you should go with physical movement with your mouth closed. And our objective is to get the breath hold time to 25 seconds plus. Then we can really push it, but we can push the body because that individual is more likely to be able to cope with it. So just as a physical trainer or personal trainer is able to tailor an exercise routine to an individual's state of fitness, state of health, and age, we too need to do that with breathing. We need to tailor a breathing program to the person's underlying breathing pattern. If I have somebody coming in with a Bolt score of 11 seconds, I will not ask that person to hyperventilate, because I could do more harm than good, and I could worsen their breathing patterns. So that's why it's very important. Always ask the question, who are you working with? That's a nutshell in terms of what we do. We have about 24 different breathing exercises and wide ranging. Now, and I'm not saying it's a cure-all, it's not a cure-all, but there's quite a bit we can do, because ultimately the application of breathing in sports, and it ranges from improved sleep to reducing oxidative stress, increasing CO2 tolerance, helping with exercise-induced asthma, improving function of the diaphragm, to stimulating anaerobic glycolysis. So our training will give you the tools. So if you're working with your clients, your students, your athletes, can you assess their breathing? Do you understand their breathing? Can you make changes to their breathing? Can you explain it? And science-based. So if you look at any of the books that I've written, even say, for example, a book on health called The Breathing Cure is about 700 references. Breathing for Yoga book is about the same. So it's really important that breathing falls into this category. If you are considering instructor training, we'd love to have you along. The courses are very affordable. So if you see level 1, the functional breathing, it's $396, and that's using a code fitness20, and that's valid for 7 days. The breathing for yoga course as well is $396. These are all online, and they're all new courses. I only finished them last year, but it brings together 23 years of breathing experience. And not just as a research, but working with real people. So I always feel that it's important you learn by working with people as opposed to solely learning theory. The advanced then is bringing everything together in terms of you've got level 1 and level 2. So you have the functional breathing, but you have the stressors, you have the body, mind, and sport. This is $876, and this comes with 7 by 2 hour sessions, very similar to what I'm doing now, but mainly practice and theory. And of course, we said if you were to buy in the next 24 hours, you also get $150 worth of free starter pack. So that's a sports mask, Buteyko belt, t-shirt, myotape, and pulse oximeter. As I said, I do have an in-person training in the United States. Face-to-face is always great, because there's just something about it. Zoom is good, but face-to-face is better, I think. But anyway, it's both work. That's the 27th to the 29th of June, and it's in Denver, Colorado. It's just outside the airport in this institute here called the Vivos Institute. So that's our slides. I'm going to open it up to questions. Any questions that you have, I will do my best to answer. And from Catherine, what is the requirement for the instructor training? We don't have any preconditions, Catherine. A lot of the people who start with us have never taught breathing before. A lot of people are coming into breathing now, and they haven't came from a health background or a sports background, so we start off keeping it very simple, and breathing can be kept simple as well. It can be kept simple. Thank you, Kim. I'm just looking at, is there a time limit to take the level 2, John and Candice? No, there's not. No, there's not. I always feel, though, better, you know it yourself. If you do something, you're as well off sticking with it and completing it. Because, with people, sometimes life gets in the way. Small airway, tongue tie. Yeah, tongue tie can be a problem, Marilla. Small airway can be a problem. And, we're talking about nasal breathing. We're talking about correct tongue resting posture. And we have to bear in mind that our children and your children who may have their mouth open right now, and that may lead to a smaller airway. Of course, soft food. And I've written books on this. I wrote my first book back in 2003 called Close Your Mouth, and I included information on the impact of breathing on craniofacial development. Children who mouth breathe, it can alter craniofacial structures. So, I only work with breathing. The little kid last night was tongue-tied. I said it to his mom to get it checked because it was likely. So yeah, I agree with you. But we're working with breathing, and ideally we're teaching our children to breathe with their mouths closed, with the tongue resting on the roof of the mouth, and the pressures exerted by the tongue will help to develop the upper jaw so that they have a better airway. And of course, during sleep, if you have your mouth open during sleep, your tongue is in a low resting posture, your airway is more likely to be narrow, you spend more time in light sleep and less time in deep sleep. And that's got huge implications too with females with upper airway resistance syndrome, because very often we think that sleep is all around men. Men snore more, men are more prone to obstructive sleep apnea, but women are more prone to a condition called upper airway resistance syndrome. And the problem with this condition is that it flies underneath the radar. It doesn't, if they do a sleep study, they don't typically stop breathing. So when they don't have breathing events that are registered, that would be typically registered in sleep apnea. In other words, their blood oxygen saturation doesn't drop to below normal. They're not frequently stopping breathing during the night. So to a sleep doctor, the sleep doctor might say, well, your AHI is 0, so you have nothing wrong with you. But it's because they have a condition called upper airway resistance syndrome, which is narrowing of the airways, which in turn increases effort to breathe. And it's the increased effort to breathe which continuously takes them out of deep sleep. And females also have different symptoms. They're more likely to have fibromyalgia, chronic fatigue, anxiety, panic, in relation to poor sleep than men, who are more likely to be tired, cardiovascular, etc. Niamh, am I missing? Is there any questions because I'm just kind of scrolling down, but there's a lot of comments.
Yeah, there are a few new questions right down at the
very bottom.
More recent ones.
Okay,
yeah.
Richard, I really love the mask. I use it all the time. Great. The Brett belt got frayed, so I can't use it. Drop me an email. We'll send you a free one. I'm more than happy to do that when you've used it so much. So my email address is patrick@oxygenadvantage.com. Can the breathing exercise you provided here help reverse lung damage from chemical exposure? Christian, I would say not. You know, I can't make any claims in that, but all I can say is this. If you have an individual who's after having lung damage due to chemical exposure, how are they breathing? You know, does it make sense for them to be breathing in and out through their mouth? Because their mouth is going to do nothing to help their lungs. Your nose is the natural filtration. It warms the air, it moistens the air, it regulates volume. It also picks up a gas called nitric oxide. And nitric oxide helps open up the airways, sterilizes the air, redistributes the blood throughout the lungs. So even with somebody with some lung damage, it's still important that they work on their breathing patterns, because I understand it. Yeah, you have lung damage, or the person has lung damage. They're going to feel breathless. They feel that they're not getting enough air. What do? They start mouth breathing. They start breathing upper chest. They start taking faster breaths. And of course, that's not going to help with the lungs. You know, so it's often a vicious cycle. Does your Oxygen Advantage have similar techniques? Yes, it does, Sawyer. It does indeed. Now, you have to bear in mind the book is 10 years old. It is 10 years old now, because I started writing it actually in 2013. But the benefit of the online course, I suppose, you're going to have a lot more up-to-date information, and you have PowerPoint presentations, and you have videos and things like that. You mentioned anaerobic. Does this also have carryover to genetic disorders? Paul, I don't know. I can't answer that question. I'm not familiar with that condition. Sorry. Thank you for today. Do you need to take 1 and 2? Niamh, you got that. Thank you. But the book is a good start, Sawyer. The book is a good start. Can the breathing... Okay, I'm seeing just some questions are repeats. It was very relaxing.
Angela here has... Well, sorry, Patrick. Angela here has her hand raised, so she'd like to ask a question.
Angela, hi, sorry.
Hi, can you hear me okay?
I can hear you.
Okay, great. Two questions, but I'll only ask one of them. One is about the course. So I have the certified functional breathing instructor course. Loved it. I came to it all in a funny way. I don't actually coach people. I have a little YouTube channel that I shared my nose breathing journey, trying to incorporate into my running. And then people started to ask me questions. So then I thought, I best get myself a bit educated, but I don't actually coach people. So I took your training afterwards, which was fabulous and helps me feel a little more secure answering people's questions. My question for you is the advanced course. Keep in mind that I'm coming from this from a bit of a different perspective, really for self-education and making sure I get a little bit of knowledge behind me. Is there any advantage to someone like me taking the advanced course, or I'm not actually coaching people? I just would really love to hear your thoughts on that.
Yeah, it's a good question. It's going to depend on who you're going to be working with. So say, for example, the course that you did is all about functional breathing. That's about everyday breathing. And that's going to be applicable to everybody. But say, for example, you have athletes who want to just get that edge. So in terms of pushing it from physical or mental performance, that's when we bring in the advanced. So we bring in the stressors. There is also, say, for example, PowerPoint presentations that are applicable to, we work with military. There's police organizations that use these as well to self-regulate. So those PowerPoints are available. Corporates, bring it into the corporates, PowerPoint is available. So it depends on who you kind of, you may just need the functional, but if you're then working with athletes, if you're working with corporates, if you're working with different first responders organizations, then the advanced would definitely come in.
Okay, that's very helpful, especially working with corporations and first responders and not really from an athletic perspective. Okay, that's very helpful. Thank you. And if there's time at the end, if other people have asked the questions, I do have a second one, but I won't take that time now.
Yeah, okay, no problem. Thank you, Angela. Richard, hi.
Hello, how's it going, guys?
Good.
So yeah, I was like saying, I like your products. I use a mask all the time.
Right.
And I have your book, and I learned the hypoxia. Right? Is it intermittent hypoxia? Is that another name for it?
Yeah, it's the technical term would be intermittent hypoxic hypercapnic training. So low oxygen, high CO2. It's a bit of a mouthful. So that's why we just call it simulate altitude training.
Right. So just a couple of things. I hope I don't take up too much time. So I have Crohn's disease, and I'm like 53 now, but I learned back when I was about 18, which is when I first started having problems, was controlling my breath to control the pain. Because I don't know how familiar you are with Crohn's. The pain can be, they say like people that have Crohn's or have similar pain, like women who have cramps, monthly cycle. So that was the kind of pain that I had, and breathing helped. And I learned this like when I was 18, just laying in bed dealing with it. So yeah, kind of weird. Now I have this new product that I just got yesterday, and it was one of the reasons I joined the meeting is to see if you're familiar with this. Just got it yesterday, comes from Canada. Can you see this bag?
Yeah.
And it's like called isocapnic training. Just got it yesterday, just starting to use it. I was wondering what your thoughts are on this. I don't know if you probably are familiar with this, but basically it's like
the whole purpose of it to blow it up?
To breathe into the bag, like someone who has like a respiratory issue. Yeah.
Okay,
but
it will really depend. If the whole purpose of the device there is to breathe against resistance, so if the resistance, if you're having to exert pressure to get the air into it, that's putting an extra load onto the breathing muscle. So it's a diaphragm, it's a respiratory muscle trainer in that regard.
Yeah, I think what they're doing is something similar to like someone who has an asthma attack where they breathe into a bag.
So a panic attack, but that would be hypercapnic. So say, for example, traditionally, if somebody's having a panic attack, they were told to breathe in and out of a brown paper bag. And it was because the individual was hyperventilating. They were losing too much carbon dioxide. The purpose of the bag was to trap that carbon dioxide, to bring it back into the lungs, back into the blood, to increase blood flow to the brain. I'm not sure if that's what that is doing. I'm not familiar with the device.
Yeah, it's basically a bag, but it's a rubber bag and it has a attachment here.
I wouldn't,
but
to be honest with you, I don't know, because that's why I asked, like, if it's rubber, was the whole purpose of it to put a pressure against your breathing, then it's respiratory. I'll give you my take on Crohn's. It's really about helping to bring balance to the autonomic nervous system.
Right.
And as long as you're on that path, you're good. I wouldn't do the stress or exercise, to be honest with you, because sometimes a good stress becomes a bad stress depending on the person. But I would really focus on a couple of things. I would focus on sleep and down regulation, mouth closed, tongue resting in the roof of the mouth, and reducing any risk of sleep disorders, which can put you into a sympathetic drive. So say, for example, snoring, obstructive sleep apnea, insomnia. I would also bring in breathing during the day to downregulate, and bring it in quite frequently throughout the day in pockets of maybe 5 minutes here and 5 minutes there. Breathe light, breathe slow, and breathe low. The training mask would have done that from a hypercapnic point of view, increasing CO2 and putting a load onto your diaphragm. I would also say do physical exercise with your mouth closed, but only going at an intensity at which you can sustain physical exercise. And I think you're going to know there's going to be stressors, and you probably know already that stress is going to be a stressor. Stress is going to be a trigger for Crohn's. So it's just on that basis. I would stay away from any of the sphere breathing exercises, and I would stick with the ones, just one focus only. How do I bring balance to the autonomic nervous system? So if that device there helps you dampen the stress response and increase the relaxation, it's going to be helpful. And if the device involves breathing against resistance, that has been shown to be helpful. And there's recently studies coming out with high blood pressure, showing that individuals who used respiratory muscle training have quite a few studies over the last 5 years showing that it lowered high blood pressure. So, but I don't know enough about the device to comment. Sorry.
Yeah. All right. Appreciate your input, but since you're in the profession, I thought, now let me bring it out to you, because again,
sure,
looks like they've been on the market for like 3 years now, and I just saw it like maybe a week ago when I jumped on it and ordered it. Just came in. I'm just playing with it right now. So
yeah.
All right. Appreciate it.
I don't know it. No, thanks. Has anybody else got any questions? Angela, you want to pop back in?
Great. Yep. Can you hear me?
I can hear you.
Okay. So my next question is the exercises that you just did with us, the 10, 20, 30, 40 paces of holding your breath.
Yeah.
I'm in the middle of a not in the middle, early stages of training for a half marathon. And so my question is, that exercise, that breath hold, and I am getting close to 60, so I'm being cautious about the breath holding. But is that something you should incorporate into the end of a run, or is that like a separate exercise that you do on a different day or later in the day of a run?
I would probably bring it in more into the start. I'd bring it into the preparation.
Okay.
So when you're going very easy for the first 10 or 15 minutes of your training, that's when I would bring it in.
Okay.
You know, I'd focus no slow and low breathing for the first, say, 5-10 minutes. And because that helps to bring balance to the autonomic nervous system. And then I would do a couple of easy breath holds and then a few slightly stronger breath holds just to open up the airways and to increase blood flow prior to going into more intense exercise.
Okay.
And then at the end of training, it will be all about breathing to get down your heart rate as quick as you can, just with faster heart rate recovery.
Yeah. Okay, great. That's very helpful. Thank you.
Sure.
Thank you.
No
Thank you
problem.
for allowing me to do 2 questions.
That's all right. No worries. Do you know how breathing relates to high blood pressure from Tracy? So there's a number of aspects to it, Tracy, with somebody with high blood pressure. One question that I would always ask is, how are they sleeping? Do they have insomnia? Do they have obstructive sleep apnea? Are they snoring heavily? Because that can put them into an increased stress response during sleep, and that will drive up their blood pressure during sleep. And the problem then is, if it continues for months and months and months and possibly years, the higher blood pressure then carries into during the day. So sleep is a question there. The second thing would be that breathing can play a role in helping to lower high blood pressure because it can help to lower stress. It can also help to strengthen what's called the baroreflex, which are pressure receptors in the major blood vessels, which are continuously monitoring blood pressure. And the ideal is that the baroreceptors are quite sensitive to fluctuations in blood pressure. So different breathing techniques can help with lowering high blood pressure. I wouldn't do the stressor exercises. I wouldn't do hyperventilation. I wouldn't do long breath holds, but I would certainly look at sleep, and I would do light breathing, slow breathing, and low breathing. Now, as I was talking with Richard as well, devices that put a resistance to your breathing, inspiratory muscle training devices, they're also shown to lower high blood pressure. We have got one, which is called the sports mask, and you will find papers on that. So when I know people use it, I had a conversation with a GP about 2 weeks ago. She uses it with her patients with POTS, postural orthostatic tachycardia syndrome. So there's a good connection there between the diaphragm and helping to strengthen and improve the function of the diaphragm and the connection it has with higher blood pressure. Any opinion on VO2 max machines? Catherine, I don't know enough about them. Sorry. Is there anything else, Niamh?
That's it, Patrick. We've
That's
got
it.
all the questions.
Great,
Yeah,
great.
if you have any more questions, you can email us at hello@oxygenadvantage.com. We'll also send you an email with all the resources and links from today's masterclass.
So somebody just had a question with, I have upper airway resistance syndrome. My symptoms are severe depression, anxiety, and severe fatigue. Will this course help me? If it's just for yourself, we did a sleep class. That's available on YouTube, is it, Niamh?
That one is on the Myotape YouTube. So if you look for Myotape on YouTube, you'll find that.
So if you look for Myotape, MYO
I'll type it
tape
in chat.
in YouTube, I just gave a sleep class to the general public about a week ago, and to show connection, I went through the exercise for upper airway resistance syndrome. So what I would say there is if it's for yourself, go through that yourself. It's free. You have it. Yeah. Okay. Thanks very much, everybody. And yeah, if you are considering breathing instructor training, we would hope you come along with us. And thanks for all your time. Take care. Bye. Bye. Thank you, Dave. Thank you, Joe.